Hey guys, I'm Kira Huron and I chose to do my case study on stress and anxiety disorders. So first we're going to talk about some definitions. Stress is a response to an adverse or very demanding situation which typically is shown through mental or emotional strain or a combination of the two. And then anxiety is a reaction to stress which can cause an individual to feel worried, nervous, or uneasy. So a stress disorder, according to the American Physiological Association, can happen in 3 different phases. The first is an acute phase, so it's a small dose, so it could be something like your car breaking down that causes you to feel stress. The second phase is called episodic acute stress, which would mean kind of like a series of unfortunate events. So your car breaks down, resulting in you being late for work, resulting in you missing a deadline, and this could go on for a day, it could be a week, or it could be a bad month. The last stage is chronic stress, and that is it's your life. It's over a long period of time, and it's due to the unrelenting demands and pressures of life. Anxiety disorders are characterized by excessive fear and avoidance, and that's usually a result of a specific object or situation that an individual is placed around or in. And the truth of the matter is that there's no danger or life-threatening circumstance. It's just something that they've built up in their head. Some examples of stress disorders are PTSD, acute stress, episodic acute stress, chronic stress, which we talked about in the previous slide. And then anxiety disorder examples would include generalized anxiety disorders, panic disorders, OCD, phobias or irrational fears, and social anxiety disorders. So signs and symptoms of stress and anxiety disorders are all very similar. They can manifest themselves in physical or emotional ways. So for stress disorders, some physical signs would be grinding of the teeth, clenching of the jaw, headaches, muscle tremors. Often people will get very sick or have infections frequently. You can have a hard time breathing, you can feel nauseous, and overall individuals are just fatigued and tired. Emotional signs would include depression, anger, worry, difficulty concentrating, feeling overwhelmed, and usually people who have a stress disorder are very unorganized and kind of all over the place. For anxiety disorders, some physical signs would include sweating, pounding of the heart, headaches, upset stomach, dizziness, shortness of breath, muscle tension or tremors, fatigue, and insomnia. And then for emotional signs, that would include feeling apprehensive or dread. You can also anticipate the worst, have difficulty concentrating, feel tense, jumpy, or irritable. So stress and anxiety disorders can come about a couple different ways. The first is a traumatic event. So this would be something huge that happens in your life that really impacts the way you move forward with your life. So this could be a car accident, an environmental disaster, experiencing the death of a loved one, physical or sexual abuse. So there are a lot of examples of that. The second is a genetic component, which, according to an article posted in the Neurological Journal, between 30 and 40% of stress and anxiety disorders have a hereditary component, meaning that there is a gene that is passed down. It can be from grandparents to parents to children for generations and generations that predisposes an individual, making them more susceptible to adopting a stress or anxiety disorder. The third possible origin is environmental stimulus. So it could be basically anything that you're surrounded by in your daily life could trigger you to develop a disease. And that could be something like your job, it could be social situations, it could be driving, it could be anything, basically. So in order to diagnose stress and anxiety disorders, there are a bunch of different procedures. It just depends what you might have. So some examples of ways that doctors figure it out are that they look for the physical signs and symptoms. They'll examine your body. They also review lab results, so they can order blood or urine samples and check out the numbers of things such as your hormones. They can ask detailed questions about your medical history and how you're feeling, or they can use psychological questionnaires to understand where your mental space is at. So today we're going to focus on PTSD, which is a mental health condition that is caused by experiencing a traumatic event. It is diagnosed according to 3 criteria, which the Anxiety and Depression Association of America says the first one is re-experiencing a traumatic event. So that can be through mental flashbacks or nightmares or anything like that. The second is avoidance. So typically people who have PTSD will avoid the situation things that remind them of the situation, that the traumatic event. So this could be like avoiding driving or anything like that. The third criteria is increased arousal. So you start to feel agitated, you can't sleep, you have difficulty concentrating, things like that. The signs and symptoms of PTSD include mental flashbacks, nightmares, insomnia, anxiety, fear, and isolation. There are a couple different treatment options, which usually it's a good idea to combine them all together for the most effective treatment. Taking SSRIs is one, therapy, and self-care. So SSRIs are a pharmaceutical medication. Therapy, you can go see trained professionals, people who have studied these diseases for years, and get help from them. And then self-care would mean doing everything possible that you have control over, such as eating healthy, getting enough sleep, exercising, and just taking care of yourself. The prevalence of PTSD, so 70% of adults in America have experienced a traumatic situation, and then of that 70%, 20% of these people will end up developing PTSD. So that would result in 44.7 million people in the United States suffering from PTSD. And women are actually twice as likely to develop PTSD, and sadly 1 in 9 women will develop PTSD. So medication-wise, I spoke of SSRIs, which means selective serotonin reuptake inhibitors. And the purpose of this medication is to ease the symptoms of depression and anxiety, making it easier for people to function in their everyday life. Usually there are not any difficulties with taking this medication and exercising. And as you can see, there are many examples, but Zoloft, Paxil, Lexapro, and Prozac are some popular options. SSRIs work by increasing serotonin levels in the brain, blocking the reuptake, and making serotonin more readily available. So serotonin is a neurotransmitter that helps control things such as mood, behavior, appetite, sleep, and memory. So what serotonin does is it is released by the presynaptic nerve into the synapse, and then from there the postsynaptic nerve absorbs it and carries it onto another neuron. So SSRIs block the reuptake or reabsorption of serotonin in the presynaptic nerve. So as you can see here, the SSRI is blocking serotonin from being absorbed back, and it's making it more readily available in the synapse for the postsynaptic nerve to absorb it. In our case study, we're looking at a female. She's 22 years old. Everything looks pretty good except for her blood pressure, which she has high blood pressure. She's sedentary, and then she is on Zoloft and Paxil. And then for her medical history, she suffered a severe car accident and watched her mother pass away in front of her, resulting in her diagnosis of PTSD. So her goals are just to reduce the occurrence of anxiety in her daily life, increase her sleep at night, and adopt exercise into her lifestyle. This would cause her to have a low-risk classification. So exercise testing, I want to be careful when I'm testing her or exercising with her as a whole, because usually people with PTSD, their symptoms can become triggered by exercise. So I would first talk to her and sit her down and see what she likes to do and kind of lay out my plan and see if she's okay with it. So I want her to do a 6-minute walk test, and then a max push-up test, a max lat pull-down test, and a max body weight squat test. And this would be because she's sedentary, but she is not overweight. She seems fairly healthy, so I just want to get a baseline of where she's at and then move on from there. So my main priority is going to be cardiovascular exercise prescription, because according to a mental health and physical activity journal, an article that I found in there, actually aerobic exercise can help reduce the symptoms of PTSD because it exposes an individual to their signs and symptoms and makes them face them head on in a controlled environment. So I would have her exercise for 40 to 60 minutes, 4 to 5 times a week of low to moderate activity. And this would be a 10 to 14 on the Borg scale. I want it to be fun because she takes her life very seriously from all the anxiety that she has, so we want to relieve a little bit of that. So whatever she enjoys doing, if it's snowboarding, skiing, biking, walking, I just want to get her out there and kind of get her out of her mental space. Flexibility and balance are going to be very important as well in her exercise prescription, because according to according to an article found in the Journal of Investigative Medicine, mind-body exercises help to reduce PTSD symptoms by a lot. It's actually very effective. It reduces anxiety, stress, depression, and anger, and increases relaxation, energy, sleep, self-esteem, and helps just cope with stress as a whole. So I would have her do balance and flexibility exercises 3 times a week for at least 20 minutes. I would have her do stretches to mild discomfort, which would be a 5 or a 6 on the 10-point scale. And I would want her to participate in activities such as yoga, stretching, tai chi, qigong, things of that nature. And our goal is just to release the stress and tension that she's holding up in her muscles and help her to breathe. So for resistance training, this would be definitely something that we work on over time, because for people with PTSD, getting in the gym can be pretty overwhelming. So I would start off 1 day a week and work up to 2 or 3 days. She would be completing 10 to 12 repetitions of 2 sets. And I would want her to be hitting her full body. So we would work each major muscle in the body at least once. And we would use machines, bands, and light weights. And the goal is just to have her get stronger. So usually people with PTSD, they can be very intimidated and weak. And so we want her to show her that she's capable of, lifting as well as combating her daily life, all the anxiety that she faces on a daily basis. Just a few special considerations. I would actually suggest that I would do the exercise workouts with her, so she feels less pressure and like I'm not just staring at her, watching her. And then the second thing is that I would want to make sure she's comfortable with everything that we're doing, because I don't want to spark any of her symptoms and make it worse for her. We want this to be a healing process. And here are my references. Thank you.